Good afternoon, everybody, and welcome to the first talk for the Sing Health Duke-NUS Global Health Institute Seminar Series 2023. I'm really proud to have everybody and really honored to have everybody here today as part of the introduction to our new SDGHI speaker series for this academic year 2023 to 2024, where we have split the entire talk for the year over three different topics. Of which we will be covering different aspects of each of the different topics. For the first topic of the year, we have, and we're honored to have Professor Renzo with us here today to give the topic of an introduction to planetary health. Prior to his talk today, I would have the opportunity to also introduce him. Professor Renzo Guinto is the Associate Professor of the Practice of Global Public Health and Inaugural Director of the Planetary and Global Health Program of the St. Duke Medical College of Medicine in the Philippines. Recently, he was also the Chief Planetary Health Scientist and the co-founder of the Sunway Center for Planetary Health in Kuala Lumpur, Malaysia. He is a member of the National Panel of Technical Experts of the Climate Change Commission of the Philippines and a convener of the Planetary Health Philippines, a community of Filipino scholars and practitioners for advancing the new discipline of planetary health. He, as an Obama Foundation Asia Pacific leader and the Aspen Institute New Voices Fellow, Dr. Renzo has served as a consultant for various organizations, including the World Health Organization, World Bank, and Healthcare Without Harm, and has been a member of several international committees, advisory boards, and networks, including 5 Lancet commissions and the editorial advisory board of the Lancet Planetary Health. Dr. Renzo obtained his Doctor of Public Health from Harvard University and the Doctor of Medicine from the University of Philippines, Manila, and received further training from Oxford, Copenhagen, Western Cape, and the East-West Center of Hawaii. He has traveled to and lectured in nearly 60 countries and 100 universities across the world, and published more than 150 reports and articles in scientific journals, books, and the popular media. Without any further ado, may I invite Dr. Renzo today to talk to us about the introductory of planetary health. Dr. Renzo, please.
Well, thank you very much, Evelyn, for the generous introduction. I didn't expect that you'll be reading my LinkedIn profile. And it's also a great privilege to be serving as the opening salvo of this new series, webinar series in SDGHI. So I congratulate you for this wonderful achievement, and I hope that I'll be giving justice to this important webinar series that you've just begun. And today I am going to give you an introduction, an overview of this new concept of planetary health. And I actually wonder how many of our colleagues in this virtual room have already heard or have heard about this concept, and please feel free to use the chat box so I can hear your thoughts. And later on during the discussion, I would love to have a conversation with you again about planetary health. And I want to start by reminding us of the times where we are in at the moment. I'm pretty sure, yes, maybe in Singapore, also here in the Philippines, it feels like the pandemic is already over, but we know that the COVID-19 virus is still lurking around. And I hope that we will not be seeing any more new waves of this infectious disease in the future. But of course, it's not just the waves of COVID that we should be very worried about. We should also be concerned, if not more concerned, about not just future waves, but as you can see in this caricature, future tsunamis of climate change and biodiversity collapse and their myriad ecological and health consequences. And today we live in the epoch of the Anthropocene, another term that I'm introducing. I wonder if our colleagues have already encountered this concept. You may be familiar with the Holocene concept, that, this is the epoch or the era of humanity, where humanity, the human civilization has flourished. But there is a proposal to even come up with a new epoch, and that epoch is called the Anthropocene. As you can see there, anthropo means man. And today we are witnessing that the greatest force that is shaping the face of the earth is not any more natural phenomena similar to what happened in the Ice Age, the Jurassic period, when the dinosaurs disappeared. But in this day and age, it's humanity that is the biggest force shaping, humanizing our natural planet. And that's why the concept of the Anthropocene was introduced. And our health is very much shaped by all of these changes happening around us, which in turn were created by us. And so I will not go into the details of this diagram, but as you can see here, it's a pathway that links the underlying drivers, the human activities. Unfortunately, many of them are irresponsible human activities, our consumption patterns, the demographic shifts that we see, rapid urbanization, migration, continuous population growth in some parts of the world, and technological advancement. All of these create diverse forms of ecological damages, which then in turn eventually lead to a wide range of human health impacts, which you can see on your right: malnutrition, infectious diseases, whether they're vector-borne, mosquito-borne diseases, or zoonosis such as COVID-19, non-communicable diseases, obesity, cancer, diabetes, heart disease, displacement of populations as a result of, let's say, climate-related disasters, and mental health, because the health of our brains and hearts is also affected by the changing environment. For instance, in the Philippines, there's growing evidence that the Filipino young people are some of the most climate anxious young people in the world, because they're already experiencing firsthand the impacts of climate change. And so, I know SDGHI is part of the Duke-NUS Medical School. St. Luke's is also a medical school here in the Philippines. And I always remind my students, my medical students, that in this day and age, we are now treating not just one kind of patient, but two kinds of patients. On the other hand, you have that kid wearing a face mask, trying to protect herself from the unseen coronavirus. On the other hand, you have Mother Earth also wearing a face mask. Of course, not to be protected from SARS-CoV-2, but to be safeguarded from the myriad ecological damages that we are inflicting on her as a result of our human activities. And so that is how the concept of planetary health was born. It came from this recognition that we cannot anymore keep on treating sick people living on a sick planet. Our patients are not just the people, but also the planet. And this is the definition of planetary health according to the 2015 report of the Lancet Rockefeller Foundation Commission, which basically introduced the planetary health concept and field. It's about the health of the human civilization and the natural systems on which it depends. So we're not just focusing on one part of the equation, it's health of people and health of the planet combined. And unfortunately, over the past century, the field of public health, the field of medicine, they have undoubtedly improved the health of human populations, added 25 to 30 years to the average life expectancy of the world. But we've accomplished these achievements, unfortunately, largely at the expense of the health of the planet. We've been putting food on the table to improve our global nutritional status, unfortunately at the expense of our natural ecosystems, which we've been destroying and turning into agricultural lands. We have also created cities that undoubtedly improve economic opportunities, access to healthcare, among others. But again, we've achieved those remarkable improvements, unfortunately, at the expense of the planet, because as we expand our cities, we are actually reducing wildlife or even encroaching into wildlife, which then lead to an increased likelihood of zoonotic spillovers, incidents when pathogens jump from animals to human beings. And that's why the Lancet and Rockefeller Foundation said it's time for a new discipline that will safeguard human health in the Anthropocene epoch, because unfortunately, public health is, while still important, not anymore adequate, sufficient to address the changes, the challenges that the Anthropocene epoch is bringing to humanity. And, a while ago, I said that this is a new concept, and it might be the first time you're hearing it. But actually, I would also say that the idea that the health of the people and the health of the planet are inextricably intertwined, this is not a novel invention. Take, for example, if we just look back to the past and listen to the words of Hippocrates, the father of Western medicine. I'm sure you're very familiar with the Hippocratic Oath, which probably many of us have recited before we entered clinical practice. But he also wrote in a less known text entitled Air, Water, and Places that medical doctors, health professionals, medical students should be studying the seasons of the year, the hot winds and the cold, the properties of water, all these environmental, ecological determinants of health that shape the health of human populations. Unfortunately, we've forgotten these clear instructions from Hippocrates. We're not even reading these texts in medical school. And fast forward in the 1990s, there is this Australian physician and epidemiologist, Anthony McMichael. He's one of the first to actually write about the linkages between climate change and human health. He once said that the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda. And I think that this radical extension that he's referring to is what we now call planetary health. So public health or planetary health is an expansion or an extension of public health. We're not saying, oh, forget about the people, let's now focus on the planet. We now just added the planet into the equation of our business, our work, our healing mission. And then fast forward down the line, he was also saying that we need to enhance our ability to collaborate with unfamiliar disciplines such as climatology and ecology. And so my questions now are, number one, amongst the people in the room, who is not coming from the health sector or the health professions? And I would love you to, write your affiliation or your discipline in the chat box so I can acknowledge your presence. But number two, and this is what I also keep on reminding my students in St. Luke's here in the Philippines, if you want to tackle planetary health challenges, you should have at least 5 friends who are not from the medical school, who's not from the health professions, before you graduate from med school, before you end up getting your degree. Because again, we need to work with the other disciplines, unfamiliar disciplines, as described here by McMichael, in order to tackle these bigger ecological horizons that he described. And again, it may sound new, but it's not new. If we just listen to the past, we listen to indigenous wisdom, indigenous communities, these people who have been marginalized for centuries have already been embracing this idea that the health of people and the health of the planet are deeply interconnected. According to Chief Seattle, an indigenous leader from the Americas, the earth does not belong to man, man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. Isn't that the planetary health message? The message that I mentioned to you at the start of this talk, that whatever we do to the planet the changes then generate myriad health impacts in the form of human either health and well-being, or on the other hand, disease, despair, if not death. And I said a while ago that this is not a new idea. And this is, planetary health also encourages us to deeply and meaningfully and respectfully engage with indigenous knowledge systems. And, Southeast Asia, the Philippines, for instance, and many of our neighboring countries have rich indigenous cultures and knowledge systems that unfortunately have been left in the margins. But planetary health, again, is a wake-up call. We need to, not throw away our Western knowledge systems, but to expand it and enrich it by listening to these voices from the indigenous communities, because they have a much more holistic view of not just people's health, but also of Mother Earth's health, as you can see in this diagram. Another way of looking at planetary health is that, and it's been once described as the grand convergence between all these different disciplines, frameworks, approaches, concepts, paradigms that we may be familiar with or that we may actually be espousing already. Tropical medicine, international health, global health, even One Health, which is the intersection between human, animal, and the planet's health, conservation medicine, social medicine, preventive medicine, because we want to prevent planetary health damages from happening in the first place. Earth sciences and systems theory and ecology, even ethics, because planetary health invites us to answer some of the fundamental questions, moral and philosophical questions that pertain to our broken relationship with Mother Earth, all creatures great and small, and how we can repair that broken relationship in order to improve the health of people and planet. So here, these are very new. This is a very new paper that was published recently, because some people and some colleagues, especially veterinarians and people who work on zoonotic infections, they usually subscribe to the One Health approach, which I already described to you a while ago. And those who are working on, let's say, climate change and biodiversity loss, they tend to congregate in the planetary health community. And here you will see in these bar graphs that, I think one conclusion is that whether you are subscribing to One Health or to planetary health, the number of papers that are being published in both spaces are increasing dramatically. But as you can see also that because One Health is a much older concept, that more publications have been published using the One Health framework, and planetary health is just beginning to catch up. But in terms of themes also, as I in a way alluded to already, One Health colleagues tend to write more about zoonotic infections, but of course, I'm not saying it's the only topic. But as you can see in this, network analysis, they all are congregating around zoonosis, and which is the blue section, and antimicrobial resistance, which is also a growing area of research in not just in human health, but in animal and environmental sciences. But as you can see in planetary health, there's a tendency to focus on climate change, but also as you can see that there is a less pronounced color coding in planetary health, because there's just so many issues that planetary health scholars are trying to address, and many of them are deeply interconnected and inseparable. So, but again, regardless of these, the concepts that we are using and endorsing, my suggestion and my advice to everybody is to dwell on the commonalities and the synergies that both communities can achieve, rather than dwell on the disciplinary differences that unfortunately do more division or create more division rather than collaboration. So now I'll go back to planetary health. And if you look at the 2015 paper that introduced the concept, of course, there's so many problems in the planetary health field. Later on, we'll just do a quick rundown of some of them. But that report summarized the problems into three main challenges. The first set of challenges is what the publication called conceptual and empathy failures, also called imagination challenges. Because planetary health, it's quite complex and there are many unknowns. It's quite fascinating that whatever is happening in the atmosphere eventually impacts the health of people and animals and plants living on the ground. But the connections are multifaceted and complex that it requires us to imagine, imagine these pathways, these interconnections, so that we can actually come up with solutions to these complex problems, seemingly insurmountable problems. The second set of challenges is what has been described as knowledge failures, also called research and information challenges. There are just many problems that are yet to be answered through research. But also this is an invitation for us to be more creative in the kinds of research that we do. Because, for example, the classical clinical randomized trial is not going to be applicable or appropriate for many of the planetary health challenges that we are trying to tackle. So there is an opportunity, for example, for AI and machine learning and big data that combines climate data and health data and animal science data, among other social systems data, in order to make sense, again, out of these very complex problems. And then finally, the third set is what has been described as implementation failures, also called governance challenges. Because unfortunately, at the moment, the design of our governments, the configurations of our economy, the ways of working that we have are not anymore compatible or aligned with the magnitude, the scale, the urgency, the complexity of these planetary health problems. So, and this is where the role of the social sciences is critical, because it invites us to think of new forms of governance, new kinds of businesses, new ways of operating as a society, so that we'll be more respectful of the planet, while at the same time ensuring that we all live healthy and happy lives. So again, imagination challenges, knowledge failures, and governance challenges. These are the three main challenges of planetary health. Now I'll introduce also the concept of the planetary boundaries, or the planetary boundaries framework. Basically what it says, and this framework was developed by the Stockholm Resilience Center in Sweden, what it says is that the planet has limits, there's a ceiling. These are not physical limits, these are biological and chemical limits that we cannot violate, because if we do so, then life on Earth, not just for people, but also for animals, plants, and other living things, will be less possible or even impossible on planet Earth. Life will be impossible. And as you can see in this diagram, there are 9 planetary boundaries that have been identified so far, because this is an ongoing field of inquiry. And unfortunately, out of the 9 boundaries that have already been identified, 6 have already been violated or breached. And they're the ones in orange. The boundary for climate change, CO2 emissions, the boundary for biosphere integrity or biodiversity, because over the past century, we have seen the fastest rate of extinction of creatures great and small. Land system change. We've been turning natural ecosystems into farmlands, into cities, into human habitations, among others. The biogeochemical flows of phosphorus and nitrogen have already been disrupted as a result of our global addiction to artificial fertilizers, again, in the pursuit of large-scale agriculture. And novel entities have already been, the boundary for novel entities has already been violated as well. And when we say novel entities, These are chemicals, compounds that we invent in the lab, we manufacture in the factory, and that we release to the environment. And one concrete example is plastic. And unfortunately, Southeast Asia is a hotspot for plastic, ocean plastic pollution, and that includes the Philippines, unfortunately. The only or the sixth boundary that has already been violated that is not yet in orange in this old diagram is freshwater use, because we have not been only over consuming water from seas and lakes, or sorry, rivers and lakes. We were also contaminating these bodies of water with all the chemicals that we're producing, including plastic. So 6 out of 9 planetary boundaries have already been violated. This should be a big cause of alarm for all of us in the health professions, because these will have huge implications for the health and survival of humanity. But also, it's not just about protecting the planetary boundaries. That is very important, but we need to remember, and this probably is already a question that is lurking in your minds, how about the people? How can we make sure that we do not violate the boundaries, while at the same time we are able to meet the social foundation, the basic needs of people? And that is why this British economist, Kate Raworth, came up with this new model called the donut economy model. And this is a fantastic book, which I think should be a required reading for all planetary health citizens, leaders, and professionals. As you can see, it looks like a donut. There's an outer circle and an inner circle. The outer circle represents the planetary boundaries, which I already described a while ago. And the inner circle pertains to the social foundation, things that we all need in order to survive and thrive: water, food, health, education, political voice, gender equality, housing, energy, among others. And basically, the donut economy is the economy or a society that lives inside that space, that safe and just space for humanity, without overshooting the ecological ceiling and without having shortfalls in terms of achieving the social foundation. So I think that this is really the biggest challenge that we have in planetary health. This is what we need in order to prevent the planetary health crisis that I described to you a while ago. We can be symptomatic in our approach. We can focus on quote-unquote clinical interventions for the myriad problems that I described, but this is the ultimate solution: a global redesign of the economy into one that respects the boundaries, while at the same time meeting the social foundation. So there's actually a very interesting study that was conducted by colleagues from the University of Leeds in the UK. And they attempted to answer the question among the countries in the world, which one is closest to becoming a donut economy? And so I invite you to take a look at the paper. They use a lot of data sources. They, of course, accounted for some confounders like population size and territorial size as well. But as you can see, by just eyeballing these donuts, you will notice that both the United States and your country, Singapore, while doing greatly in terms of the social foundation, you will see that there are not many reds inside the inner circle. Both countries, unfortunately, have already violated almost all the planetary boundaries, the planetary boundary budget that have been allocated for these two countries. Meanwhile, as you can see at the bottom, my home country, the Philippines, has not violated yet any planetary boundary. So that's the good news. But the bad news is, as you can see, there's so many reds inside, and that just highlights the unfinished business of the Philippines when it comes to achieving the social foundations for its citizens: health, food, housing, among others. And according to this study, the country that is closest to becoming a donut economy is a country that is a few hours away by flight from both Manila and Singapore, and that is our neighboring Vietnam. As you can see inside, there are not that many reds because they are already slowly achieving the social foundation for their citizens. And they've only violated one planetary boundary to a very minimal degree, and that is the boundary for climate change, carbon emissions. And so I guess the question that we should all be answering is, how can we all be like Vietnam, a country that is close to becoming a donut economy? And that is a challenge for Singapore too, a much smaller country, very prosperous, but unfortunately has already violated its share of the planetary boundaries. And maybe we can learn from cities that are already beginning to experiment and innovate on the donut economy model, and one of which is Amsterdam. At the start of the pandemic, they already made a declaration that they will be embracing the donut economy model as their basis or as their model for their post-coronavirus economy. So I already gave you an intro about planetary health, the key concepts and frameworks, the definition, the values, and even the two frameworks, the donut economy and the planetary boundaries. I just want to remind you that one of the planetary boundaries, which is the boundary for climate change, is going to really impact the health of human populations. And I will not be going into the details of this diagram, but as you can see, there are many pathways that link climate change and human health, and that there's no single disease group that is going to be immune to the impacts of climate change. Again, name it: mental health, check; infectious diseases, check; nutrition, injuries, and many others, non-communicable diseases, all it will be impacted by the climate emergency. And for the physicians in the room and also other health professionals, you might be interested in visiting this very interactive website from the New England Journal of Medicine. You can actually click on the organ system and it will tell you how climate change will affect that organ system. So every clinical specialty, in fact, has a role in addressing climate change, even at the clinical level. And you can also use this as a teaching tool to your students. We also need to remember that while planetary health problems such as climate change will impact the entire world, unfortunately, the health impacts are going to be unfairly distributed. As you can see in these maps, the parts of the world that have emitted the greatest amount of greenhouse gases into the atmosphere are not the same countries that will be bearing the brunt and that will be suffering the consequences of the climate crisis. You will see Africa, Asia; these are the ones that will be impacted. Unfortunately, or on the other hand, the ones that have created this crisis are largely North America, Europe, and most recently China as leading emitters of carbon. So the question now that we should all be answering is this: the medical community is operating as if the global climate system is doing okay. We have, for example, mounted a pandemic response, a global pandemic response that did not take into account the planet or the climate crisis. And we've created new forms of PPE pollution as a result. So how can we make sure that we are not contributing to the climate crisis? Are we ready to build health systems that consider the climate? Are we ready to become health professionals that embrace planetary health principles and values? That is the question. And so in the coming slides, I'll just give you a quick rundown of what we can do as part of my conclusion to this talk. Number one, there's this concept called climate smart healthcare. We need our healthcare systems in the era or the epoch of the Anthropocene to become climate smart. And climate smart is the convergence between sustainability and resilience. Sustainability means we are not an accomplice to the climate crime. We are reducing as much as possible our carbon footprint, our ecological footprint. We are greening the sector. We are practicing environmental friendly interventions. On the other hand, the health sector should also be resilient, adaptive, a sector that bends without breaking, a sector that is the last sector standing when climate-related disasters strike. because we don't want to be victims. We want to make sure that we are able to still protect the health of people, even in the face of a warming planet. So these are the things that we can do. So for example, this is a report that I co-published, and basically what we are seeing here is that there are several things that we in the health sector can do in order to decarbonize our sector while still achieving universal health care for our citizens. Shifting to renewable energy, transitioning to sustainable transport, serving healthy and nutritious and sustainably produced food, green purchasing from environmentally sustainable pharmaceutical companies, among others. So these are just some examples of hospitals in the Philippines that are already embracing solar power and renewable energy. And I wonder if many of our hospitals in Singapore are also already embracing renewable energy and energy efficiency measures. We also need to make sure, as I've said, that our health sector is resilient to the impacts of climate change. When something happens, whether it's a shock like a typhoon, an intense flooding, or a stress like an increase in infectious disease burden, we are able to recover from it and even transform to become better, to become a stronger health system. And so in the Philippines, what we're now doing is we're working with local health systems. As you may be aware, we have 7,000 islands, and many of those islands are already facing the health consequences of climate change. So we're working with local health workers to enhance their ability to, again, respond to the challenges brought about by the changing climate. And again, as I've mentioned, we can also bring planetary health inside the clinic. So here is just a sample of what the different specialties are doing: the gastroenterologists, the family physicians, primary care, emergency room physicians now being trained on how to address heat-related illness as they show up in the emergency rooms. So there's so many things that we can do even as clinicians. But remember, we should also work with the other sectors, because planetary health requires a cross-sectoral and transdisciplinary approach. We can only improve health, human health, and also address the climate crisis if we are going to work with the urban planning sector, the energy sector, the transport sector, agriculture and forestry, because all of these sectors will also need to reduce their ecological footprint, their carbon emissions, to stabilize the climate and to improve human health overall. So we should also be exploring nexus approaches. For example, there is this popular approach in the field of sustainable development, the nexus approach, where you bring together water, food, and energy sectors to address shared challenges. And you know what's missing there? Human health. So the public health sector should be part of these new nexus approaches. And one example or one arena where we can truly make a difference is when it comes to food, because nutrition is a public health issue. And there is a new concept that was introduced also in the Lancet in 2019. It's called the Planetary Health Diet, a diet that is good for the planet while also still being good for people. And as you can see in this Planetary Health Diet, the bulk of the plate is comprised of vegetables and grains, whole grains, and a very minimal portion is allocated to red meat. In fact, if you translate this into a week-long diet, it means we will only be eating meat once among those 21 meals that we used to eat each week. You know, if you're eating 3 times a day for 7 days. And the question is, can the Asian diet transition to the planetary health diet? Can Singaporeans and Filipinos forgo of their favorite hawker food or Jollibee in the case of the Philippines to transition to the planetary health diet? That is a big challenge, a big question. So in the Philippines, we have now an initiative that looks into the feasibility of the planetary health diet in order to achieve a sustainable food system in Metro Manila by 2050. So how can you be involved and what can we be doing together? So first, I invite you to be part of the Planetary Health Alliance, which is headquartered at Harvard University. You can visit the website, and I hope that, I believe NUS is already part of it. Maybe SDGHI is not yet. And we hope that you can be part of this growing global family. We need to embed planetary health into the education, not only of health professionals, but of all citizens, from the young to the young at heart. And I will not belabor you with the details of this planetary health education framework, but as you can see at the center, we need to restore our broken interconnection within nature. And it says within nature, not with nature, because we live in nature, we're part of it. And we need to make sure that this is present at all educational levels. So I hope that we will also be working with those in primary and secondary education as well. We need to start young, but we also need to educate or re-educate our adults who are making important decisions now for the future generations. In the Philippines, we established the first planetary and global health program in Southeast Asia. And so this is my fantastic team. And what we've been doing is we've been trying to take advantage, for instance, of digital technology to allow students from the Philippines and from other countries, for example, in Africa and in Europe, to learn about planetary health together. And I hope we can explore how we can include Singapore in this growing family of planetary health educators. This is an example of a course that we are about to finish now. It's in collaboration with some Dutch universities, where Filipino students and Dutch students are together learning about climate change and planetary health. Again, because these are shared challenges. And whether you live in the Philippines or the Netherlands or Singapore, all of us will be impacted by these problems. We also came up or established a national network called Planetary Health Philippines, and I invite you to visit planetaryhealth.ph. It is our community of scholars, advocates, practitioners, young people who are promoting the field of planetary health in our country. And this is amazing and exciting because we're very interdisciplinary, intersectoral, intergenerational, international, because we also include Filipinos from outside our country as well. And I'm so excited that it's not just in the Philippines, but across Southeast Asia, we are now seeing different institutions starting to come up with planetary health initiatives, projects, centers, units, and I already included there SDGHI in recognition of this inaugural webisode that you have organized, and I'm very grateful that I have been a part of it. So in conclusion, I am reminded by this quote from this great Indian novelist, Arundhati Roy. She said in an article which she published at the start of this pandemic, that the pandemic is a portal, a gateway between one world and the next. And every time we go to a new place, we travel, we needed a source of information. We need a sense of direction. And therefore, we need a new compass. But of course, in the 21st century, no one uses a compass anymore. We all use a Google map. So what is the Google map for the future? And I strongly believe that planetary health is our new compass, our new Google map towards this green, healthy, and just, quote-unquote, post-COVID future that we are all aspiring for. And in order to do that, we cannot just be literally putting out fires, and that's already happening in some parts of the world with the wildfires associated with the climate crisis. What we need is to renovate the political economy of planetary health from this old classical thinking of the economy that we can draw an infinite line as if the planet does not have limits. And instead, we need to shift towards a donut economy way of thinking, making sure that we do not violate the boundaries while at the same time meeting our basic human needs. Planetary health is also an invitation for us to embrace planetary humility. It invites us to shift away from this ego-logical perspective. Oh, we human beings are at the top of the pyramid of nature. We can consume, pollute, kill, mine, extract, contaminate. And instead, we need to shift towards a truly ecological approach, where we human beings live in harmony with all creatures, great and small, and in greater interdependence, with deep respect for all the other components of planet Earth, our one and only home. And finally, I think that planetary health is an invitation for us to become good ancestors. What we want is that in 2123, which is 100 years from now, the children of 2123 will read the history books, will look back to the past, and they will say that the COVID and climate generation of 2023, which is all of us in this room, have been good ancestors to them because we made the right decisions, not just for our own health, but also for their health and well-being as well. Are we ready to be not selfish ancestors, but to be good ancestors to these children and to the future children of Singapore, the Philippines, and the world who are yet to come? So together, let's advance the health of people and the planet. Thank you for listening, and I look forward to your thoughts and questions.
Thank you very much, Dr. Renzo, for that very interesting talk. I think we actually do have a lot of questions that's actually coming in. And I thought that the best way to actually just kind of group your questions together would be to follow the three challenges that you actually talked to us about within the talk itself. So I think you mentioned that there was this knowledge failure, conceptual and empathy failure, as well as implementation failure. There's a lot of questions that's coming in regarding from the implementation point of view, and maybe we'll take some questions with regards to the implementations that individuals or organizations can do. I think Orlando has asked a question within the group chat itself. And Orlando, I'll just read out the question that you asked. A lot of medical devices and medications have a high plastic footprint. For example, there are a lot of injectable medications for diabetes and obesity that are single-use and thrown away. How can we shift the industry away from that without compromising patient safety and hygiene? Would you think better recycling systems or upstream innovation or coming out with some sort of a carbonization indicator to evaluate the latest drug therapies to incentivize pharmaceutical companies in coming up with more of a planet-friendly drug delivery system?
Yep. Thank you very much, Orlando, for that amazing question. Very important, not easy, but it's an issue that there are solutions for. And the solution to this crisis, this issue, is multifaceted. There is a role for us consumers of these products to use our advocacy and pressure even the pharmaceutical companies or the device companies to change their behaviors. So there's this innate power amongst all of us consumers and buyers that we are underutilizing. I think there's also a role for governments. So for example, our ministries of health to come up with explicit regulation about the use of, for example, more climate-friendly alternatives. Of course, the main question will be, how about the price? How do we deal with that? And I think there are many potential options that we can, deploy. For example, if we bulk purchase, entire hospital systems and even networks of hospital systems purchasing and making explicit their preference for green products, we might and we will be able to reshape the market for these kinds of products. So I mentioned the consumer side, the policy side. There's a role for innovation as well, and we should be incentivizing manufacturers, perhaps through tax breaks or some subsidy or whatever, to continue innovating and producing products that are still healthy for patients, but also healthy for the planet. And so those are just some options. And also there's a role for monitoring, which you're alluding to, like an indicator. And that's something we're working on right now. I'm part of a Lancet commission focusing on sustainable healthcare, and that might actually be one indicator. We need to be monitoring companies and consumers as to their decarbonization efforts. And also there might be a role for health technology assessment. So when we start evaluating new technologies, usually we only evaluate them based on safety, effectiveness, and price. But maybe we should start incorporating environmental sustainability as another criterion. I hope I was able to answer the question. Thanks.
Yeah, definitely. I think it's a continuation of that question. Somebody actually submitted questions on our initial registration form as well, and somebody actually asked, so a lot of these participants on the call could actually be MPH students or PhD students who are doing their individual researches and things like that. And in a way of organizing these talks is to see how we can actually group them all together and to have a social sort of network in order to link people together. And someone had actually asked the question of how they can relate planetary health to his or her own research in health policies and system research. I thought since you were talking a little bit more about that, perhaps you could talk a little bit more in detail about what we can do in potentially for these MPH students as well.
Sure. Well, planetary health, as you may have already gleaned from the talk, is an exciting new arena for research. Yes, we're tackling very difficult problems. I might have painted at times that we are in a gloom and doom scenario or situation. But at the end of the day, there's so many problems that need to be addressed through research and innovation. And I also mentioned that planetary health is an expansion of public health, right? So, whether you're working on maternal health or children's health or, health financing, there certainly is a connection between your work and the broader planetary health challenges that we are now facing. So, for example, do you know that pregnancy is going to be affected by increasing exposure to heat? Or, children will need to be protected from climate-sensitive diseases. Or adolescents are the ones, as I mentioned already a while ago, the ones already experiencing climate anxiety. And how can we redesign mental health systems to provide mental health care in an era of a warming planet? So there's so many topics that we can actually work on, just from my presentation. I'm sure there are like 1,000 topics embedded in those slides. But I think these are some of my encouragements. Number one, all of us in the health professions, in the health research community, should now begin thinking about our own research interests and how they connect to planetary health, because there's a connection. And, it starts with a willingness to do it, right? And to also collaborate with the unfamiliar disciplines. Because if you want to link your work with climate change, you definitely need to work with people who are experts in the climate sciences. If you're wanting to look into the links between, wildlife and a particular disease area, then you need to work with people working in the ecological sciences. But we also need to make sure that planetary health is in the research agenda of our countries and even of our institutions. And so I hope that SDGHI and NUS, like what we're doing here in the Philippines and in many other universities, will position planetary health as part of the themes in the research agenda. And also I hope that our funders of research will also catch up and make sure that there's money for these important and yet under-examined arenas in planetary health. I'll stop there. Thanks.
So I think there's still one more question which I want to continue on with that question. So you've mentioned so many things in terms of the list of potential planetary health projects and collaborations across the healthcare sectors and things like that. If I had to force you to pick one, the top priority, which you think potentially would be the highest, perhaps the lowest lying fruit in terms of feasibility and implementation, in terms of in the healthcare setting, whether or not it's across microbiology, biodiversity, or whether or not it is just in financing itself. What do you think would be that top priority that would be the lowest lying fruit for us to try to achieve at least?
Yep. That's a difficult question. It's like you're asking me which among my children is my favorite, right? But certainly the climate crisis requires our utmost priority and attention. We only have 7 years remaining in order to achieve the Paris Agreement goals to stabilize the global climate and to make sure that we have social systems, including health systems, that are ready to address the climate challenge, right? So just in the climate and health nexus alone, there's so many things that we can do within our sector, among our clinicians in the room, in the different health areas. And I hope, again, that this will be a major research priority of SDGHI and the NUS as a whole in the coming years before we reach the deadline that I mentioned. Thanks.
I hear you. I mean, in my mind, I'm just thinking to myself, for all the people who are involved here, I personally come from oncology, and obviously one of those things that we talk about is the micropollutants in the climate that technically can predispose patients to lung cancer as well. So these are the things that we do talk about as well. Okay, I will just wait if there's any other questions. But prior to that, I think in the interest of time, I will also be asking you just two more. And I think this is the question that I see multiple people have been asking within our group as well. Uniquely Singapore, I think this is something that we all want to know a little bit more. I know that you presented a paper that showed that Singapore is actually we're not very good in terms of planetary health and in maintaining our planetary reducing the waste. Recently, in the last couple of years, within SGH and within the other institutions and hospitals in Singapore, there's been some talks about zero waste as well, not just human waste, but climate waste, a lot of different waste within the hospital system in order to streamline that system. What do you think Singapore, uniquely Singapore, be our location or the fact that our import exports are all primarily reliant, that 90% of our food exports are from other countries? What do you think is uniquely Singapore that we can actually do to help to, in a way, protect our planetary health?
Yep. Well, first and foremost, it's great to hear that there are initiatives already happening within the Singaporean healthcare system. So maybe that donut, which was published a few years ago, would have changed a bit, right? Because of your effort. So maybe that's one thing that we should.
Yeah.
That's one thing that we should do
Sure.
soon, right? Recreate the donut for Singapore in 2023. But Singapore is certainly a very interesting and unique place because it's a small city state with limited even natural resources. And I can imagine that there might be some boundaries where Singapore will unfortunately not be very successful in even protecting or addressing, for example, biodiversity. But there are areas where you can make a huge difference for sure. Of course, emissions wise, you can dramatically reduce your emissions, and it's going to be a challenge because how can you retain your level of prosperity while at the same time not contributing to the killing of the planet? And that's a domestic discussion that you should have. There might be some opportunities when it comes to water and also the novel entities like plastic. I hope that Singapore can play a leadership role in those areas. But for other boundaries where Singapore domestically might not be able to address, for example, biodiversity, this is where you can play a much more regional or global role. For example, if you can help through your resources, whether financial or intellectual and political, if Singapore can help its neighboring countries protect all the rainforests in Southeast Asia, then that will be your contribution to planetary health. So it doesn't need to be just within your own backyard. We all have, whether you're in Singapore or in the Philippines, have regional and global responsibilities for planetary health. So that's just my quick answer, and I'm sure it requires an entire webinar in itself.
Okay, that's great. And I think we have enough time for one last question. So I'll keep the interesting question last. And I think somebody asked this question from an individual point of view. Okay, so we talk about taking big picture, talking about moving institutes and hospitals and government organizations. And a lot of the time, I think, at least for many of us who are trying in our own way to conserve the environment, a lot of the times we ask the question, what can an individual do? I think there's a lot because an individual obviously in healthcare can perhaps do a little bit more in coming out with all these knowledge gaps and studies and things like that. But one of the questions that somebody actually asked was that how can I motivate not just other healthcare staff, but my own administrators, or my own organization, or influence key hospital leadership to invest in solutions that can promote planetary health. I think that would be a good ending question to this entire series.
Brilliant. Thank you very much. And well, number one, I hope that we have leaders in the room right now so I can actually directly, and I hope that I was able to directly speak to them about the importance of planetary health and the role of the health sector. But what can you do, one, we need to walk the talk, right? And it's hard. It's going to be hard. And we need to be in alliance with colleagues, in your own department, in your own unit. Can we just start these new green practices? Can we incorporate climate change into our module that we teach to our students and our residents? So there are already things we can do at the micro level, And I think once we have shown, and this is how it works usually, you can protest in the street and not be able to influence the leaders, but you can walk the talk and show positive examples and practices, and there might be an opportunity and interest to scale them up. And then eventually it becomes hospital-wide or medical school-wide. So I guess it's a combination of advocating for these changes to happen. Now you have the knowledge. Feel free to use my slides and the references to communicate the evidence to our leaders. But also we need to start doing it in our own spaces, because if more spaces will do it at the same time, it will create a ripple effect, and eventually it will lead to long-lasting institutional transformational change. I'll stop there.